21st, 2024 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley. Here. Mr. Blankley is present. Ms. Bonnick. Here. Ms. Bonnick is present. Mr. Brew. Here. Mr. Brew is present. Mr. Cruz is excused. Mr. Dondorfer. Mr. Dondorfer is present. Chairwoman Hasman.
Here.
Chairwoman Hasman is present. Mr. Milne. Here. Mr. Milne is present. Ms. Smith. Here. Ms. Smith is present. Ms. Vasquez Simmons. Here. Ms. Vasquez Simmons is present.
Is there anyone signed up for the public forum?
There is not.
Is there anyone present who has not signed up to speak who would like to address the committee at this time? All right, seeing none. Pat Gooch, Senior Planner for Monroe County's Planning and Development Department, will now give a brief overview of the 2025-2030 Capital Improvement Program as it pertains to the Human Services Committee.
Thank you, Chairperson Hasman. You should all have a copy of the recommended 2025-2030 CIP. This report reflects the culmination of an 11-month process beginning in late summer with departments proposing a 6-year funding plan for capital projects. A committee reviews the proposed projects and requires changes based on project priority and fiscal constraints on the program. After review by the county executive, the CIP is submitted to the county planning board. The planning board reviews the CIP, holds a public hearing, and sets priorities for the capital budget year, which is the first year of the CIP, or 2025. The planning board returns the draft CIP to the county executive, who then submits the recommended CIP to your honorable body. At the June meeting of the legislature, you will set a public hearing for July, and then, upon your favorable review, vote to adopt the plan. There are no funding approvals associated with taking action on this referral. I'll highlight a few departments. The Medical Examiners Program is found on page 14 and 15 of your CIP. Each year, the office evaluates instrumentation in order to remain abreast of current drug trends. This evaluation leads to equipment replacement to improve sensitivity and/or analytic capability in determining cause and manner of death. The Medical Examiner's proposed program accounts for 0.22% of the total capital program. The Monroe Community Hospital program begins on page 20 of the CIP. Monroe Community Hospital is a chronic care residential healthcare facility owned and operated by the County of Monroe with over 700 employees. The hospital is nationally recognized for its research in geriatrics and chronic diseases. It is a dynamic healthcare facility, it must continue to keep the grounds, physical plant, kitchen, laundry, medical service, patient furnishings, and information technology up to date and functional. In total, the 8 Monroe County hospital projects account for just under 3% of the capital program. I'll be happy to take questions when you get to this item on your agenda. Thank you for your time.
Thank you, Mr. Gooch. The next item on the agenda is the approval of minutes. You have the April 30th, 2024 meeting minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk?
Referral 24-0163, adopt 2025-2030 Capital Improvement Program.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Is there any discussion? Yeah, Legislator Milne.
Thank you, Madam Chair. A couple of quick questions. Through the chair to the administration, when were these project cost estimates for the CIP completed, and how confident is the administration that we will remain within the 10% of costs shown in this proposal?
Through the chair, the cost estimates for the CIP are up to date as of this year. So the projects in the CIP are provided throughout the 6-year cycle. As projects come to the capital budget year, 2025, those numbers are refined to ensure that they are within the actual anticipated costs and budgeting for each department.
Thank you very much. Follow-up question, again, still through the chair to the administration. Were any of the projects in this portion of the CIP delayed, downsized, or canceled? And if so, can you provide a list of such?
Through the chair, we can provide a list, yes.
Thank you very much. And lastly, through the chair to the administration, what new projects were added to this portion of the CIP, and or if so, can you, if needed, can you present that list to us?
Through the chair, yes, we can provide a list, and it is denoted in your CIP in bold, but there are 27 new projects throughout the 6-year cycle added to this 2025-2030 CIP.
Thank you very much, sir. I yield the floor.
Further discussion? All right. All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0167, amend Resolution 382 of 2018 as amended by Resolution 83 of 2024 to accept additional funding from the New York State Department of Health for the STD Testing and Safety Net Populations Program, amend Resolution 412 of 2020 as amended by Resolution 421 of 2021, as amended by Resolution 369 of 2022, as amended by Resolution 368 of 2023, as amended by Resolution 83 of 2024, to amend and increase the contract with Rochester Regional Health through its Rochester General Hospital permitted laboratories to provide clinical laboratory services for the Monroe County Department of Public Health.
Thank you, Mr. Clerk. Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Is there any discussion? Yes, Legislator Smith.
Thank you. Through the chair, how many patients are tested and cared for through this program?
Could you repeat the question, please, through the chair?
Yes, through the chair to the administration. How many patients are tested and cared for through this program?
Through this safety net program, we test approximately 1,500 patients per year, 1,500 tests per year.
Thank you. And through the chair as a follow-up, is there a rise in these diseases that you have seen?
Through the chair, there is a slight increase in the number of cases diagnosed each year.
For all three, what is it? Tuberculosis? So this supports the tuberculosis control program, correct?
Second.
Oh, that's,
Following.
Through the chair, I'm sorry, I thought we were on the safety net grant for the STD program.
yes, you are. Thank you. I'm good. Thank you.
Further discussion? All right, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0168, amend Resolution 215 of 2019 as amended by Resolution 315 of 2022 and Resolution 272 of 2023 to accept additional funding from the New York State Department of Health and extend the time period for the tuberculosis prevention and control program.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Is there any discussion? Yes, Legislator Dondorfer.
Thank you. Through you to the administration, how many people does this program treat each year?
Through the chair, the number of actual cases of active tuberculosis disease varies by year. In 2023, we had an anomaly, only 6 cases for the year. That is extremely unusual. This year already, so far, we are only in May, and we've had 7 new cases diagnosed. In addition, we treat a number of people who are infected but not actually sick with the disease. That's called latent TB infection. And that number of people also varies by year, probably 500 to 800 per year, depending on the year.
Thank you. I yield the floor.
Chair to the administration, is there a reason for the increase of those cases?
Through the chair, it's hard to say. Across the state, there were a reduced number of cases found during the pandemic. Our numbers were not suppressed as much as some other counties, but there seems to be a sense that perhaps now we're getting a rebound from people who maybe were confining themselves and are now out and findable.
Thank you.
Further discussion? All those in favor? Oh, I'm sorry, Legislator Brew.
To the Chairwoman, to the administration, when the Health Department determines that there's a person who has contracted TB, are there efforts in place to investigate the source of the TB that has infected the current patient?
Through the chair, the response to a case of active TB is called an outbreak investigation, and all of the contacts that that person has, the people that they have been living with, working with, spending very much time with, are sought out, and we attempt to do screening on each one of those individuals.
Thank you.
I'll try again. Is there any further discussion? All in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0185, acceptance of a grant from the New York State Office of Children and Family Services for the Family First Mobile Response Program.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Any discussion? Seeing none, all those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 24-0187, authorize a contract with Cure Violence Global to provide consultation services for the Monroe County Department of Public Health.
Moved by Legislator Vasquez Simmons, seconded by Legislator Blankley. Any discussion? Yes, Legislator Brew.
Yes, to the Chair of the administration, who were the other respondents to the RFP, please?
Through the chair, there we go. I believe there were only 2 respondents, but we will get you the exact answer to that question.
Okay, to the Chair, I appreciate that. And next question would be, can you give a brief overview of the program and its goals, please?
Through the chair, yes. So the Cure Violence Assessment will be inviting a group called Cure Violence Global to come to our area and do an assessment of all stakeholders and efforts in our area that are targeted to reduce violence. So there will be workshops to explain the Cure Violence model for how to try to reduce violence. There will be meetings between the expert team and healthcare providers who are involved in the trauma center that receives injured victims of violence. There will be a survey done of community-based organizations that are participating and working with victims of violent acts and trying to reduce retaliation. And this assessment will all be pulled together into a final report that will give a lay of the land on which the Cure Violence Group will determine whether specific areas of Rochester are a good fit for their larger intervention. If they determine that Rochester is a good fit for this initiative, then we would come back to this body and request funding to engage in that initiative, which would involve hiring individuals to serve as interrupters of violence, so interacting with victims, with perpetrators, to try to break the cycle of violence. And if they determine that Rochester is not a good fit for this program, we will still benefit in that we will have had an external entity come and do this assessment and provide us with a very detailed report that will list for our department who are the partners, who are the victims, which are the areas that are most deeply impacted. And this group has an expertise in doing data analytics with law enforcement information that we currently lack in my department. I know how to analyze health data, but not so well how to analyze law enforcement data. So even if we do not progress to the next phase of doing the full, engaging in the full cure violence model, we will still have a rich data source from which to invite all of those partners that we will have then identified to try to address the problem of violence in our area.
Okay, thank you. A couple of follow-up questions through the chair to the administration, if I may. So would this initiative be, would it include domestic violence, or are we talking just more street violence, violence of that sort? I wonder if you might be able to help out in understanding that.
It's not domestic violence. No, this would exclude the very complex topic of domestic violence and really focus more on interpersonal violence with firearms, more like street violence, gang violence, that area.
Thank you. Another follow-up question, if I may, to the chair. Has there been any historical, I guess, performance data provided by Cure Global, Violence Global, who has actually performed this work in other cities or any communities of our similar size that would indicate that it does have the potential to be successful?
Through the chair, there is extensive evidence of marked decreases in violence in the geographic areas in which this program is enacted. It is not a program that is meant to encompass an entire city. There are specific geographic limitations to the areas that would receive this initiative, but there are positive and striking decreases in violent acts in cities as diverse as Rio de Janeiro and Philadelphia and New Orleans, and even smaller cities in the Midwest. I'm trying to remember which ones they are, I apologize, but there is a wide variety of size of municipality that has engaged with this group with pretty striking improvements.
Okay, thank you. And another follow-up question, if I may, through
Absolutely.
the chair. So it would appear that the target areas would be within the borders of the city of Rochester itself.
Through the chair, the target areas would be determined based off of, again, law enforcement data that indicates areas of highest need, of highest frequency of violent acts.
Okay.
So historically speaking, one could predict that it would be within the city of Rochester, but it would be a data-driven approach.
Right, but it does have the potential through the chair to be a countywide effort depending on where those hotspots are, correct?
Through the chair, yes, the data would determine where they would choose to enact their
Thank
the
you. Yield
initiative.
the floor.
Further discussion? All right, well, I would like to take a moment to explain my vote. I would like to applaud the administration for this referral and its recognition that violence is a public health issue and it will require public health solutions. The American Public Health Association, the American Medical Association, the Centers for Disease Control and Prevention, the American Academy of Family Physicians, the World Health Organization, the American Academy of Pediatrics, and even the Department of Justice all recognize that violence is a public health crisis. When we approach problems using a public health lens, we can identify risk factors and protective factors, develop prevention strategies, and ensure widespread adoption of effective strategies. This referral is an important first step. The contract with Cure Violence Global uses data-driven and evidence-based strategies in their approach to curb violence, something that our community needs and will greatly benefit from. So I'll be voting yes, and I encourage my colleagues to do the same. All those in favor, please signify by saying aye. Aye. Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the May 21st, 2024 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will